I'm Doug Bierma. My patients call me Dr. B, and I'm a pediatrician with DuPage Medical Group. Being sick a lot as a kid and going through all of the testing and everything has really made me want to not be doctorly. I try and joke around with the kids, I try and be friendly, I try and make it less clinical and more fun. I've had whole interactions with kids who at the end of the visit, they're like, "When's the doctor coming in?" I'm really pleased with that because I've been able to do my entire evaluation and figure out what's going on, and the kid never realized what we were doing. He thought it was just fun. Understanding development is really key to knowing what's going on with a kid, because what's going on at 6 weeks old versus 6 days old versus 6 months old versus 6 years old, it's all incredibly different depending on their development. If you have a child who's developmentally delayed, so they're 5 years old, but they're cognitively at a 3-year-old level, you can't treat them like a 5-year-old, you have to treat them like a 3-year-old. The most important thing is to make sure that we have the right diagnosis. So we make sure we have the right diagnosis, and then we see where the child is at that time, where they've been, where they are, and where we want them to be. Development is huge, and I talk about development at almost every visit. My main approach is to be a doctor and a teacher. And more than anything, I want the family to walk out feeling like, oh, I never knew that. I want them to be able to have learned something as well as what to do with this particular illness.